Title: What is anemia? Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body's tissues. Having anemia can make you feel tired and weak, shortness of breath, and a poor ability to exercise. There are many forms of anemia, each with its own cause. Anemia can be temporary or long-term, and it can range from mild to severe. See your doctor if you suspect that you have anemia. It can be a warning sign of a serious illness. Treatments for anemia range from taking supplements to undergoing medical procedures. You might be able to prevent some by eating a healthy, varied diet. 1. Aplastic anemia. Aplastic anemia is a condition that occurs when your body stops producing enough new blood cells. Aplastic anemia leaves you feeling fatigued and with a higher risk of infections and uncontrolled bleeding. Anyone can get aplastic anemia, but it's more likely to happen to people in their late teens and early 20s, and the elderly. Males and females have about an equal chance of getting it. Treatment for aplastic anemia might include medications, blood transfusions, or a stem cell transplant, also known as a bone marrow transplant. 2. Iron deficiency anemia. Iron deficiency anemia is a common type of anemia, a condition in which blood lacks adequate healthy red blood cells to carry oxygen to the body's tissues. Iron deficiency anemia is due to insufficient iron. Without enough iron, your body can't produce enough of a substance in red blood cells that enables them to carry oxygen, hemoglobin. As a result, iron deficiency anemia may leave you tired and short of breath. You can usually correct iron deficiency anemia with iron supplementation. Sometimes additional tests or treatments for iron deficiency anemia are necessary, especially if your doctor suspects that you're bleeding internally. 3. Sickle cell anemia. Sickle cell anemia is one of a group of disorders known as sickle cell disease. Sickle cell anemia is an inherited red blood cell disorder in which there aren't enough healthy red blood cells to carry oxygen throughout your body. Normally, the flexible, round red blood cells move easily through blood vessels. In sickle cell anemia, the red blood is shaped like sickles or crescent moons. These rigid, sticky cells can get stuck in small blood vessels, which can slow or block blood flow and oxygen to parts of the body. There's no cure for most people with sickle cell anemia. But treatments can relieve pain and help prevent complications associated with the disease. 4. Thalassemia. Thalassemia is an inherited blood disorder that causes your body to have less hemoglobin than normal. Hemoglobin enables red blood cells to carry oxygen. Thalassemia can cause anemia, leaving you fatigued. If you have mild thalassemia, you might not need treatment. But more severe forms might require regular blood transfusions. You can take steps to cope with fatigue, such as choosing a healthy diet and exercising regularly. 5. Vitamin deficiency anemia. Vitamin deficiency anemia can occur if you don't eat enough foods containing folate, vitamin B12 or vitamin C, or it can occur if your body has trouble absorbing or processing these vitamins. It's important to have your doctor diagnose and treat your anemia. Vitamin deficiency anemia can usually be corrected with vitamin supplements and changes to your diet. Click the link below to the playlist for more videos on information regarding anemia.